Good morning. Hi, my name is Angie. I'm going to be your nurse today. I just received orders from the doctor that we need to insert a Foley catheter on you. Before I get started explaining everything, can I get your name and date of birth? I see we got Taylor Gibson. Okay. That is matching what's on my bracelet. Date of birth 7/17/1972. Okay, great. And then allergies, I see compazine and penicillin. No latex allergy or anything like that. Okay, great. So like I said, the doctor has ordered for a Foley catheter today. It looks like you're going to be going down for surgery in a little bit, so we want to go ahead and get that in place. Have you ever had a Foley catheter before? Okay, you have. So just a little quick reminder, you know, this is a tube that is inserted into your bladder. It will help drain your urine. If you do feel like an urge or anything like that, we do want to make sure sometimes that tubing, if it were to get kinked or anything like that, could make you have that sense of urgency or spasm or something like that. So just let us know. But goal is put it in, have it in for surgery while you're on bed rest. Might leave it in for the next 24 hours or so. But once those orders are lifted, we want to get it out of you as soon as we possibly can. We'll drain your urine, so if you do have any questions, just let me know. If you have any pain or discomfort, also just let me know with that. So if you don't have any questions, I'm going to go ahead and get started here. I'm going to give you this extra blanket. Just try to provide some privacy. I know this is not the most comfortable thing to have done, but I will try to give you as much privacy as possible as we get ready to get going. Just pull these down, make it a little bit easier here in a few minutes. All right. Before I would do anything, if we needed to do any prenatal care or anything like that, now would be the time before we got our tray and everything set up. Just take a peek. Everything looks pretty clean, but if we needed to clean you up, we would. I like to use this as a trash can, not necessary. Alright, pull these blankets down. Alright, before I get you uncovered, I'm going to raise your bed up just a little bit, bring you up to a working height here. All right, so like I said, we didn't need to do any prenatal care, but now would be the time to do that if I needed. So when it comes to doing my sterile field, things that I need to keep in mind when setting this up, I want to only touch the outside portion, being very careful when I open this package. I like to call it our ballerina arms. We want to open first away from us. Sometimes these packages can be a little fickle. So once I've pulled this paper down below my waist and below the edge of this table, that area then kind of becomes the non-sterile portion. So sometimes it's good to hold a corner, try to keep it from folding back in on itself. Best thing you can do. So again, I'm not reaching over my field, I want to reach around. Only touching that outside portion. So it does come with a set of sterile gloves. I personally like to bring my own, but I never throw them away in case for some reason I get my sterile gloves contaminated. So there's a couple different ways you could go about this. You can either try to grab an outside corner very carefully on this, staying in that 1-inch border that would be the outside. So then therefore your field is still sterile on the inside, or you can put your sterile gloves on at this point. That way it makes it a little bit easier to manipulate your drape. But if I'm gonna grab, I'm gonna step back, only touching outside border here. I want shiny side of this piece of paper down on the bed, making sure I'm not going over my field. And then I'm gonna just gently try to tuck this under my patient's hips to keep the inside of that as sterile as possible. Okay. So when I'm doing my sterile field, I never want to turn my back on my field. Once I turn my back, my field is considered no longer sterile. I personally, when I'm doing my sterile field, anytime I'm putting on my gloves, I like to take a step back from my field. That way I don't run the risk of those fingers hitting my paper. If I had on sharp jewelry or anything like that at this point, I would also take that off before I go to glove. So a couple different things I can do. Sometimes I like to just leave this package here because it also gives me an additional sterile field if I need it, or I can just scoot it into the trash. Either way, I just want to make sure if I do pick it up, I don't grab in that 1-inch border, or if I drop it in the trash can, I do not drop my hand below my waist. So most kits will come with a fenestrated drape, which we are not going to use, but that is a personal preference if you would like to use it. I'm going to just drop it in the trash. Got my cleansing swabs here, so I'm going to go ahead, just open those up. A few different ways you could go about this. Sometimes I like to maybe just scoot that, staying inside my 1-inch borders here. I can put this down if I need to. Sometimes makes it a little bit easier, or I can leave it on top. Either way is perfectly fine. It does come with a specimen cup, so if I needed to get a urinary specimen, I can use this cup. I like to just personally loosen that lid if I need to, but then I can also set it here on my field. Outside doesn't have to be sterile, I just personal preference. So when I'm removing this packaging, I just want to make sure that I am careful in dropping that catheter and not dropping it outside my sterile field. Take that, drop. So at this point, I've prepared my field. There's a couple different things I can do. I can either leave my box here, which is perfectly fine, or I can move it in between the legs if I would like, and move my field down. Now, if I'm gonna do that, I do need to think about when I go to clean, I don't wanna reach over my box. I don't wanna go over my sterile field. So there are a couple different ways you can do that, okay? So if I'm gonna transfer this over to the bed, which I think that's what I'm gonna do today, is I'm gonna transfer it over to the bed. So sometimes you can do this a few different ways. You can just reach on the inside. This whole box is sterile at this point. So it doesn't really matter how you grab it, as long as you just don't touch anything as you're dropping it. So the inside of your box is truly what you're aiming for sterile, okay? So at this point, I've moved my field over, and the second I touch the patient with my non-dominant hand, it will no longer be considered sterile. So then I will only have one hand to work with here. So before I do that, I am going to go ahead and just take that out of there, make it a little bit easier for myself. All right. I'm going to get ready to touch you here. You're going to feel me touch. So I'm going to spread the labia, clean. So again, I don't want to reach over my field. I'm just going to drop. I'm going to do this 3 times. Clean. And then clean. All right, you're going to feel a lot of pressure here. So I'm going to insert into the urethra. I'm going to advance until I see urine, and with this being a female, I will go a couple more inches once I've seen urine and advance that catheter. Once I've went just a couple more inches after I've seen urine, I'm then going to stabilize the catheter with my non-dominant and inflate my balloon with 10 mils. Should be able to do a slight tug, should stay in place, and remove. Okay. So this one now I can take the catheter, move my drapes out of the way. I want to hang my bed bag on a non-movable portion of the bed. Utilize my leg strap to secure this in place, making sure that my tubing is going over the leg. It is dependent, no kinks or anything in my tubing. All right, so let me put on my securing device here. Put you in a little bit more comfortable position here. All right. Throw away my trash here just a second. Let's get you covered back up. You feeling okay? No pain or burning or anything like that. Like I said, you might have a few spasms. And that might be kind of common here at the beginning, but if you continue to have any spasms or anything like that, let me know, okay? Mess. Lower it back down. Here, wide as I reach. Is there anything at all I can get for you right now? No? Okay. Like I said, you'll be going down for surgery, and our goal is to get that out as soon as we possibly can.